Hello, and welcome to Psychology Demystified. Today's topic is about 2 words that I'm going to hope that you delete from your vocabulary when you're dealing with someone who is in pain. We're also going to focus on what to say instead. At our core as humans, we like to make meaning of the things that happen in our lives. In other words, we call ourselves meaning makers. Typically, what we do is that we live through an event. We then work to interpret what this event means to us, and then we try to bring order to our lives based on the event that has just happened to us. When we endure pain and when we endure happiness, what we find ourselves doing is that we try our hardest to frame this pain and this sadness and understand it. And sometimes we try our best to find value in the pain and the sadness. This process that we go through is really important for us and to us because it's how we try our best to move on, and it's also how we try our best to try and live with an experience that we've gone through. When we then see a loved one going through something painful, what we try to do is we try to help them make meaning of their experiences and try to minimize their pain or to reduce their pain in a way that we think is the best way that we know how to. And how do we do that most of the times? We try to make them see the bright side of things. It's not unusual to find ourselves saying things like, "At least you still have your health," or "At least your marriage produced your kids," or "At least he lived well into his 80s, so he lived a good life," or "At least you still have a job," or "At least it wasn't cancer." I heard someone telling someone else the other day, "At least you can have kids," when they had just gone through a miscarriage after experiencing secondary infertility. When we're using these 2 words and saying the words "at least," most times we assume that you come from a place of good intentions and that you mean well. In many cases, what someone's trying to do is they're trying to help the person who's grieving to see beyond their pain, to feel gratitude amidst their pain, to feel like, yes, there's a difficult stretch that they're going through right now, but there's a light at the end of the tunnel. And absolutely, yes, sometimes saying what you're saying rings true and is true. Someone who's experienced a scare may not actually have cancer, so you're saying at least you don't have it. And yes, it is true that someone who's losing a grandparent who's in their 80s or 90s has probably, yes, lived a great life. But that's not how it comes across when you use the words "at least," because then it feels like you're making someone immediately try to see that there's something that they should be grateful for at a time when they don't want to experience gratitude. So what is wrong with using those words, "at least"? Well, there are 2 issues. The first issue is that someone needs to come to their narrative in their own time. Someone who has just lost a loved one does not want to look on the bright side. That is not the frame of mind that they're in. At that point in their lives, probably the pain is too fresh, the memory is still jarring them, and the moment is just plain difficult. Someone who's experiencing or going through the end of an unhappy marriage doesn't want to sit back at that time and cherish the good times. Not in that moment. In that moment, they simply just want to grieve the end of something that they thought would last forever. When we tell someone to try and look on the bright side of things when they're not ready, and to look on the bright side of things according to our schedule, what we're actually doing is we're inadvertently circumventing their grief process and trying to have them jump past their own grief, which at that point is uncomfortable, so that they can help us feel comfortable in the moment as well. And by having them jump past the uncomfortable process of grief, what you then end up doing is that sometimes you may diminish their grief and diminish the impact that their loss has on them. The end result is that someone ends up feeling like they've been rushed and pressured to be okay when they're not. You need to work to help them understand that feeling bad at that particular time is normal, feeling bad at that particular time is natural, and feeling bad at that particular time is fully, highly, completely, and totally appropriate. The second issue with offering the words at least is that the person who you're trying to help may never find meaning in the way that we would like them to find meaning. Everyone needs to be allowed to grieve in their own way. Everyone needs to be allowed to process their sadness in their own way. What usually happens when someone moves through sadness is that he or she tries to make sense of their own reality. And eventually, when they're ready, they craft a story that allows them to be able to live with the experience of grief. Sometimes, in their own time, this may come as gratitude that, yes, at least I still have these amazing children from that unhappy marriage. Yes, it may come from being grateful that you had all those great years with grandma or mom or dad, but it has to be in their own time. And you know what? Sometimes that gratitude doesn't come, and that's okay. Some people just come through a painful experience and never ever see the silver lining. And that should be okay too. Let this person accept the pain for what it is and move on in their way at their own time. To these people, the at least may never come. And that's just how they function, and that's just how they deal. Us telling somebody to look on the bright side is simply our way of making us feel better about their pain. But it's something that may never resonate with them. So then that begs the question, what should I say instead? I just want to help. When a loved one is going through a difficult time, instead of using the words at least, try using these phrases instead. Try and say something like, I understand that's really hard. How are you doing? If they tell you something is hard for them, try and ask them, so which part of this has been the hardest for you? I'm here to listen. And simply do that. Listen. Don't speak. Try asking them whether they'd like to talk about it. And if they don't, ask them if they'd like to talk about something else. Because sometimes people just don't want to address the issue at present because it becomes their reality and they're not ready for that reality. Another thing that could work is simply saying, I'm sorry, and being content to just sit in silence with them. That's it. When I say these phrases, they sound pretty straightforward, but many times they are harder to say than telling someone to look on the bright side. And why are they considered harder? They're considered harder to say because they involve sitting with someone else's pain rather than trying to rush through it. Another reason why these phrases are sometimes harder than saying at least is because they signal to someone that you're willing to be with them, to sit with them, to listen to them, even when it might make you uncomfortable, and even when it involves uncomfortable silences. And you know what? Sometimes that is exactly what someone needs from you. As always, thank you so much for watching. Please remember to be kind because you really don't know what someone is going through. And to you, hugs and kindness always. Bye.